Good afternoon, everyone. My name is Nicole Boyle, the Director of Student Health Services for Metro Schools. Today I wanted to speak with you about vaccines and physical examination requirements upon entry for your kindergarten child. So we're going to go over what parents should know, and thank you for joining us today. After we go through this presentation, we'll have a brief time to answer any questions that you may have. So what parents should know. So starting school upon kindergarten enrollment through the ages of 4 through 6, your child will need additional doses of certain vaccines. We also want to recommend that the flu vaccine, you get that every year, but we'll talk a little more about that in just one moment. Another requirement upon entry into Metro schools is that your child will need a physical examination and proof of that exam. You will also need to submit an updated Tennessee certificate of immunization as well. So what are the entrance requirements as far as a physical exam? All students entering MNPS must present proof of the required immunizations and physical examinations from within the United States. So the physical examination must be 1 year prior to the date of which you registered your child or the enrollment into the school. So for example, if you enrolled your child on May 20th of 2020, then we would accept a physical examination from May 20th of 2021, excuse me, the physical examination from May 20th, 2020. So you have that 1 year period that we will accept that examination. Appointment cards showing scheduled physicals are not accepted, and we will also hold these physical examinations in your child's CUME record, and the physical exam may be documented on the Tennessee Certificate of Immunization, or it can be a separate paper signed and dated by your medical provider. As far as the entrance requirements for immunizations, we require the official Tennessee Certificate of Immunization. That is the only thing that we accept. We do not accept, we oftentimes have some facilities who will make almost like a duplicate of the official Tennessee certificate, but it's not the official one. So we only will accept the official one, and this can come from your medical provider or the Metro Public Health Department, okay? Certificates are valid only for the grade in which the certificate states that it is valid for, and we'll go over that in 1 minute. Updated certificates may be required for continued enrollment if your child is given a temporary certificate. Official immunization certificates and any attachments must be filed in the student's CUME folder and will stay in your child's record. Schools do not provide parents with the immunization certificate. As I stated earlier, only health providers can provide these forms. And parents, you may fax copies of the certificate, you may email them, or you may hand deliver them to the schools. So what you're looking at now is an example of the certificate of immunization, and where the red check is at the top, that is an example of the health examination documentation. It can be documented on this immunization certificate, or as I stated earlier, it may be also, you may also send in a separate documentation for it. If you will look to the bottom, in the bottom left-hand corner, box D should be checked and says complete for K through 6 grade. That must be checked prior to submitting to the school. And then of course the circle on the lower right hand side is we want to make sure that the provider documented, they date and sign and date the certificate. If the lower left hand box D is not checked, we will not accept it. So what vaccines are actually required? So there are vaccines that can be, these vaccines can be given between the ages of 4 and 6. And prior to kindergarten enrollment, your child has probably already received the hepatitis B and the hepatitis A shot. So those must be required, but you probably received those prior to being 4 years of age, the child. What we're going to see most of the time given between the ages of 4 and 6 is the second dose of varicella, which is the chicken pox, the DTaP, diphtheria, tetanus, and pertussis, and then your second dose of your MMR or your measles, mumps, and rubella, and then your final dose of the polio shot. And you will see just a quick immunization schedule. They have flu in there as well, and we do recommend this every year, but it is not required. So why vaccinate? We want to keep the school community healthy. So vaccinations throughout childhood are essential because it does help provide immunity before children are exposed to these possible life-threatening diseases. So, and also the vaccines have been tested to ensure that they are safe and effective for your children at the recommended ages. And please remember also that these immunizations are required prior to entry. So at the time of registration or enrollment for the first day of school, we need this information. So what I'm going to do now is transition to any questions that you may have. So I'm going to stop presenting and we can go over some questions.